A sudden pop sidelined a softball player with an injury we're seeing more of in female athletes. Coming up, we explain the procedure and the months-long rehab that has Lael Barnes back on the field. Good morning, I'm Alexis Del Cid. Welcome to the Morning Medical Update. Today we're talking about a very common but very serious injury among throwing athletes. A torn UCL in the elbow. It's also known as a Tommy John injury. And for DeSoto High School softball player Lael Barnes, that injury could have sidelined her sports career. But after UCL reconstruction surgery, physical therapy, and months of rehabilitation, she's now been cleared to return to the field. Jessica Lovell shows us.
Lael Barnes' love of the game started early with her brother and her dad.
They were throwing in the front yard, and I was like, I want to play.
It's just in the blood.
So I started playing catch with them, and I've always had like a really strong arm, and they were like, we got to get you signed up for softball.
It started when she was 7. Now a junior at DeSoto, Lael pitches for her high school softball team, but years of love for her sport has put wear and tear on her arm. It was during a game in the middle of the season she threw and heard a pop.
And I was like, it's probably fine. Happens all the time. So I go back to get in line, come back up to throw, and I throw the ball, and my arm just kind of drops, and it's like all these sharp pains, shooting pains up my arm. And I try to go back to lift it up, and I can't lift it. It hurt so bad, and it was like probably the worst pain I've ever felt in my life.
She talked with her trainer, who referred her to Dr. Vincent Key, orthopedic surgeon with the University of Kansas Health System's Sports Medicine Department and head team physician for the Kansas City Royals. An MRI revealed Lael had torn her UCL.
And I was like, wow, okay, season's over. Like, I guess I knew that there was a tear, but I wasn't sure how bad it was.
Dr. Key performed Tommy John surgery to replace and repair the damaged ligament. He told her it would take some time to get back on the field, but she could do it.
That was like probably the hardest 3 months of my life, because I still had to go to practices, and I'm just sitting there watching everyone else play, and I'm like, oh my gosh, like I just want to play so bad.
So Lael got to work with physical therapist Kyle Veazey at the University of Kansas Health System's Sports Medicine and Performance Center.
PT was actually like really hard because you just want to play so bad. You want to get back really soon, and you just can't, because you just have to keep working through it till your body's ready.
After 7 months of tough but consistent physical therapy, Lael is back and beyond ready to pitch her first game.
It's just like full of excitement, because I've been going through so many months of building my body back up, building my mental game back up, and it's just like, I'm ready. I'm so ready.
Let's turn to our guests for this morning's discussion. Joining us live from our Sports Performance Medicine Center is Lael Barnes. Hi, Lael. It's great to see you.
Hi.
And alongside Lael is Kyle Veazey. Kyle is a physical therapist at the University of Kansas Health System's Sports Performance Center, and Kyle helped Lael through her rehab. And joining us via Teams from the airport lounge is Dr. Vincent Key. Dr. Key is an orthopedic surgeon and the head team physician for the Kansas City Royals. So Dr. Key, you're on your way to the Dominican to do some physicals for some future MLBers.
Yeah, that's the thing, is that getting on the plane, got here last night, getting on the plane this morning, along with some other physicians from the University of Kansas Health System, Dr. Nolan, Dr. Rosemont, our cardiologist, and his crew. So we're going down to do physicals on some of our players in the academy. Each Major League Baseball team has an academy in the Dominican. So we go there probably about 3 times a year to do physicals.
Well, you're so busy, and we so appreciate how accessible you are, and you're also representing the Royals. Let's see the shirt. Nice. It's got a shirt on. Well, thank you for taking time out of your busy schedule. Lael, I want to start with you. First of all, how are you feeling physically today? How's the arm?
I feel great.
And we have an x-ray.
My arm doesn't hurt too bad. Sorry.
No, that's okay. We have a little bit of a delay. I'm going to have to be patient, so I give you time to talk. You were saying you still have a little pain in your arm, but it's not as bad?
Honestly, it's not pain. It's more like just aches and soreness after throwing, which I guess I should be expecting because I haven't thrown in like a year.
It's good to see you smiling because you could tell just how sad and upsetting it was when you were talking with Jessica about how you just had to watch your teammates pitching and what a surreal experience that was. We have an X-ray that was taken of your arm that we want to show our viewers. So how was your injury initially first described to you?
I mean, at the game when I initially tore it, they just kind of gave me a bag of ice and told me to kind of walk it off, and then we'd go see the trainer. So I wasn't expecting it to be too bad. Like, I definitely knew something was wrong, but I didn't think it would be that bad. And then I went to go see the trainer, and she was definitely worried, and that's when I started to get worried. And then I knew it was pretty bad.
I want to bring Dr. Key back in here. Dr. Key, UCL or these Tommy John injuries are something we've talked to you a lot about when it comes to baseball players, but we've learned from you that they're becoming more common in softball and other throwing sports. Why do you think that is?
I think a lot of it still comes back to training and being able to work the kinetic chain. I'm seeing it more and more in softball. Women's wrestling is another huge one that I've seen it in. I'm taking care of a couple of javelin throwers with these injuries. So again, I think it comes down to just making sure that your shoulder's good, your shoulder blade's good, your core's good, your lower half is good to protect the elbow.
It's interesting that you say wrestling because we associate it. Lay people outside of sports medicine think of a throwing sport. So what exactly is the UCL doing, and why is it so crucial for athletes, including those wrestlers and the other throwing athletes that we're talking about? And also, as you answer that question, we have video of you doing another Tommy John repair on a patient recently. Now, we want to warn our viewers, this is medical video of a surgery. It's very explicit, but it's fascinating to watch you in action. So go back to my question. What is it that the UCL does that's so crucial for these athletes?
Well, it helps to stabilize the elbow when throwing. And it takes a lot of force on that inside part of the elbow when you're throwing. Throwing's not a normal thing. And the other thing in wrestling, I think in wrestling it's more traumatic than it is anything else. And I've seen it, again, more in female wrestlers because of what's called their carrying angle. And that's the way their arm is positioned, and that's just the way God made them. But sometimes falling onto the elbow or even damaging the elbow by a certain hold or a certain move can cause that injury as well.
I got to ask you, when we look at this surgery video that you show us, it was surprising to me, as someone who doesn't have a medical background, how physical you have to be. Like, you're flopping it around and you're pulling on it and you're bending it. And I always think of surgery as being a very fragile, delicate process, but that's not delicate. The video we're looking at, why do you have to test that motion so much and really put your weight into it?
Well, I'm still dainty. I mean, it does look a little rough. But the thing is I test the arm before I do the procedure, and you test the arm after you do the procedure. And usually there's a marked difference in stability from the beginning of the surgery to the end. And then also making sure that the graft is stable, being able to, because I'm drilling tunnels and putting the graft into the tunnel, and I basically take it and lift the arm off the table just to make sure that graft is well fixed. And that gives me a little bit of peace of mind and definitely gives the patient the stability that they need.
Yeah, and these are athletes. They're not going to be going easy on their joints once they're out of your care. I want to bring Kyle in. Kyle, when an athlete like Lael comes into physical therapy after this type of surgery, what are those very first steps in rehab for you?
So the first thing is just getting to know the athlete and the type of sport they play and what their goals are to get back to. But early on, the first visit and even the first several weeks of sessions, it's all about protecting the ligament that was reconstructed or repaired, and then working on getting the swelling out of their arm, and then working on just gradually restoring the range of motion of their arm, especially the straightening part, or what's called elbow extension. That's the most critical piece early on in those first few sessions. But then we want to gradually protect the incision and make sure that everything's healing up really good. And then we can introduce some lower body exercises and some light cardio. And that's kind of our first things that we focus on early on in the early stages.
And then when you're dealing with younger athletes, how important is it for you to also keep them on track emotionally, keep their spirits up?
Sometimes that's the hardest part. So it's fun whenever someone like Lael comes in, because we had a good banter back and forth, and we can joke around with each other and just be really authentic with each other, because that seems to make rehab go much better. Because it's a long road, and you got to come a lot, and you come week after week after week. And in their world, it's like they can't do the thing they love doing, and now they have to come see me, and it's like, well, that's not very fun. I'd rather be playing softball. So it's great to develop a rapport and relationship, but especially with the younger athletes and high schoolers or adolescents, you got to find some way to keep them mentally engaged and really understand that while we're working in physical therapy, it's really like mind, body, spirit. We're working the whole person. So that's what we really try to focus on.
Lael, I want to ask you about that part, because you were a junior in high school. This injury was devastating for you, and it was a long recovery. And we could tell when we watched that interview that the emotions were so close to the surface for you when you were talking about what it felt like to be on the sidelines. How did you get through that emotionally? What helped you the most?
Definitely just having my family and friends around, just letting me know that everything's going to be okay, and I'm doing this all for a reason, and I'll eventually pull through and be even better.
And Dr. Key, you performed Lael's UCL reconstruction surgery. What does that procedure involve? What did it involve specifically for Lael?
Oh, what it involved was taking a tendon from her forearm, called the palmaris longus. There are some people that don't have that, probably about 10 to 12% of the population. So sometimes I have to take the graft from their lower leg, their hamstring tendons, and then shape it and position it and drill tunnels into her bone, into her ulna and her humerus, and then dock it in her ulna with a bioabsorbable screw, and then dock it into her humerus, her upper arm, with suture through a tunnel. And it usually the graft is much larger than her native graft. Then I take her native graft and then I tie it into the reconstruction. So it's almost a 4-ply technique in terms of reconstructing these. And it's been found with some of these to be the strongest construct out there. So it's a procedure that's tried, true, tested, and it'll give them the longevity that they need to perform the sport.
So from all the years that you've been doing this and you've been operating on athletes, what do you think is the most important component to their recovery, and not just recovery, but coming back as strong as they were before the injury?
Well, I think there's two things. One is the mental side of it, being able to trust your elbow, being sure in your mind that the elbow is going to do what it did before and hopefully better. I think the other thing is just cleaning up the kinetic chain. Again, that's what usually will cause these. And being able to make sure your shoulder blade, your core, and your lower half are right to protect the elbow. And that's why you throw better after Tommy John surgery. It's not just the ligament. The ligament is a reset, but you're cleaning up everything else to make your body more efficient.
So athletes are coming out of here throwing better than they were even before their injury. Lael, has that been, do you feel like you're on track for that?
Oh yeah, definitely. I definitely feel my throws are stronger and harder.
That's awesome. Kyle, we know rehab is such a huge part of this process. So what are the key exercises that you have an athlete do to start to build back their strength in their arm?
So there are some really critical shoulder blade or really like posterior shoulder girdle exercises that form a foundational level of strength that are just really necessary for a throwing athlete to eventually get back into throwing. But just like Dr. Key said earlier on during this rehab and even the first couple months of rehab, it's really about building from the ground up. So we're looking at how their foot and ankle works and how their lower leg works, and we're doing a lot of hip and hamstring exercises. We're doing a lot of neuromuscular control exercises, so just getting the lower body to move with the trunk and their core and then moving with the upper body. Then we start to kind of set the table in order to be able to do the fun stuff later on, like throwing. So there are a lot of foundational exercises that we do both for the upper and lower body, but we will tailor it based on the individual athlete and what sport or position in that sport that they play.
So Lael, who was the one that told you, gave you the news, okay, you're cleared, you can go back to pitching?
Aiden, I don't know how to say his last name. It starts with an R.
What was that moment like when they said you're back?
I don't know. It felt great. Like I was like, wow, I really went through all that physical therapy and now I get to throw.
I do have a question for that. I've always wondered this, when you're finally back, you're out on the mound, you're pitching, did you have any sort of PTSD or reservations, like you were holding back because you were treating yourself a little more fragile than you needed to be, if that makes any sense? Was it hard to just let go and give it your all?
Yeah, I definitely feel myself holding back, and like even sometimes I just catch myself holding my arm sometimes just like babying it, because it really is a mental thing, and
Sure.
I'm still trying to get over that a little bit, and it's really hard to get over that. Yeah.
That makes total sense. We want to let our viewers know that if you're watching and you have any questions or comments that you'd like us to read out loud on the program, you can send them to us right now on our YouTube page or our Facebook page. Those links on how you can connect with us in real time are right there on the screen. So, Lael, how soon after your surgery were you actually throwing in a game again?
After my surgery, I didn't get cleared till like what?
Was it months?
December.
Was it weeks?
December,
months,
I think.
Yeah. Okay.
Months, yeah.
And your surgery was when? Your surgery was
When
in.
was your surgery?
Oh, when was it? June. It was June 11th, I think.
So 6 months later, you were playing, or you were throwing again. So now that you're cleared, what's your goal? You're going to be a senior next year. What's your big goal after this? You see college?
I don't know.
college
I
plan in your
really,
future?
I've always had, I've always had college in my future. So that would be really fun. But I'm just excited to be able to play with all my friends again.
Yeah, I bet. Dr. Key, you're also, as we know, the head team physician for the Kansas City Royals. So you work on athletes of all age ranges. What lessons from professional sports medicine do you apply when you're treating young athletes like Lael?
I try to treat them all the same. I mean, human is human. I think that, the same issues you have as a high schooler, you have as a professional athlete. The thing is that at the professional level, it's a job, and they're being treated every day. They're being monitored every day. Whereas in the high school ranks, it's fun, which it should be. There is a trainer there, but the trainer has 800 other kids to deal with too, on top of just the one athlete. So I think, again, instilling knowledge, whether it's in the high school ranks or in the professional ranks, is very important in terms of the athlete themselves. And even though an athlete may be paid $15 million a year, they still got to own it. They still have to do the work to keep themselves on the field. At the high school level, yeah, they're not making money in it, but they want to be on the field, just like Lael said, and play with their friends and do things like that. So again, it's a different carrot, if you will, sometimes, but the end is still the same. Everyone needs to prepare.
Kyle, you work with so many athletes from across the health system's partner schools, including DeSoto, where Lael goes to school. How important is that relationship between physical therapy, the surgeons, and the athletic trainers?
It is so important. I was actually just talking with Kara yesterday. Having our athletic trainers in our partner schools, it just allows the care of the athlete to be so much smoother and easier. So although it is a large health system, it's really just a great resource that we have and a great model that we have, where we have our orthopedic surgeons and sports med physicians able to connect with and collaborate with their own clinical athletic trainers and nurses, and then the athletic trainers in our partner high schools, and then they can talk with the physical therapists in our different locations. So we all try to do what's best for the athlete, but it really helps us communicate and makes it easy to work with people, because then everyone's updated and everyone knows the latest and everyone knows what's going on, and is the athlete doing awesome and things are progressing really nicely, or is there something that's worrisome or concerning, or hey, this athlete told me this yesterday, or did you hear that, or when they were in PT this week, were they mentioning any of this? Or then I can Teams or text or call any of the athletic trainers and go, hey, I just saw so-and-so and here's my thoughts on it. Can you start working on this in rehab, or what do you think should be our plan? So it's just a really great setup we have that just allows us all to communicate and talk, so that way we can do what's best for the athlete.
It really takes a village. Lael, you had so much support from your school, your athletic trainer, Karistine, throughout this whole process. How important was that support system for you?
It's super important. It's really nice just being able to know that so many people care about you and want to see you get better and get back to what you love doing.
Dr. Key, I know you have a lot of strong feelings on how to train and prehab so athletes don't get injured. What advice would you give young athletes, if you had to give them the best piece of advice you have, who are playing those year-round sports and might be putting stress on their arms?
Well, I think number one is rest. Everyone has to have rest. Sometimes more is not better, smarter is better. So there has to be about 6 to 8 weeks where you don't do anything. You don't pick up a ball. Now, you may stretch and do those things, but you're not actively competing. And I think, in this day and age where, people are playing year round, you have to prepare your body year round. If you're playing softball or baseball, especially at the high school level, and I just take it, in the state of Kansas or Missouri, there's not too many games compared to the warm weather climates, Florida, California, Texas. So if you're a pitcher, you need to, your tryouts are the first week of March. So you need to be really dedicating yourself to your kinetic chain January 1st. If you're a position player, it needs to be about 6 weeks prior to tryouts, which is usually in the middle of January. So again, you have to give yourself a long runway to be able to get yourself ready to compete. It's not like you just fall out of bed and you can just start throwing, because the forces on the shoulder and the elbow go up exponentially once you hit puberty. So it's really important to, like I said, prepare your body to be able to compete.
You were saying you think young athletes should have 6 to 8 weeks without picking up a ball. Do you see that, or are you seeing less and less of that?
It's hard because, again, people are competing for scholarships, things of that nature. And again, everyone thinks more is better. They have the pitching coach. They play catch with their friends. They have the competitive team that's, in December going to California and playing. So it is less and less. but I'm seeing more and more injuries, so something's got to give. I mean, I think that again, the rest is always good, always good.
That kind of leads to my next question: is what do you wish parents knew?
Again, I think number one, the fun factor to me is huge. You know, if a kid has that talent, they're going to find him or her. And again, parents are spending a lot of money for these kids, and there's a lot of pressure on these kids to be able to perform and compete, given the fact that money's being spent on them. But the bottom line is, let the kid have fun. His talent, his or her talent, is going to be there. You can build up an athlete only to a certain degree. Then you have to let them go and see what they can do. So and sometimes a little bit of pressure is okay, to understand, is this something you really want to do or not want to do? But for the most part, this is all about having fun. And if your child is able to get their education paid for playing a sport, great. If not, let them have their time.
Kyle, I have one more question for you, and then we have some viewer questions. Is there any sort of exercise, a specific exercise that any athlete watching can do to keep their arm healthy during the season? Something you want to see more of?
I think I'm going to tailor this to your earlier question about the younger athletes and some of these adolescents I see and some of the middle and high school age athletes and the parents. Is they're doing a lot of baseball specific or softball specific training and chasing velocity and working on throwing. What I wish they did more of was learn how to move their body and get control of their lower body with their upper body, because the lower body needs to be working at a really coordinated level with the upper body in order to do awesome things like pitch and throw and all the things that they ask it to do when they're doing baseball and softball in particular. So I wish younger athletes spent more time learning how their body moves and learning to control their body and getting just better movement and motor control. I think that would really help their upper body and help their shoulder and their elbow.
Janine has a question for Dr. Key. This is interesting. She just wants to know, is pitching for baseball players more taxing on the arm than softball players, or does it put the same strain on the arm?
So that's a great question. I think throwing a baseball, the torque on the elbow is much higher than pitching, because pitching, throwing a baseball, you're going overhand as opposed to softball where you're going underhand. But the stress is still high, even going underhand. So what you see, you'll still see them in softball pitchers. Obviously, Lael's there to tell you that. But also the volume in softball, I see it in catchers, and I see it at third base. So you also have to take into account the volume as well as the veracity in softball. Baseball, again, you got guys throwing 96, 97, 100 miles an hour. And, by common sense, there's going to be a lot of force on the elbow in terms of that.
As we wrap up this discussion, I'd love to get today's takeaways. Dr. Key, what do you want our viewers to take away most from this discussion?
I think the bottom line is, number one, prehab. Get your body ready to compete. Number two is, if you're going to compete most of the year, you need to be doing your exercises most of the year. And you can't fall off, and you need to stretch every day. Every person's going to tell an athlete to get stronger. No one tells them to get flexible. So like I tell them, stretching is every day. Strengthening is every other day or 2 days in between. So again, get your body ready to compete, and it won't totally negate your risk of injury, but it'll significantly decrease it.
That's similar to what Kyle has been saying. Kyle, what do you want our viewers to take away from this?
Yeah, I want to echo that and say a maintenance program of stretching and of doing some strengthening work in season is actually a great way to keep your arm healthy and keep your body healthy. So even when you feel great, even when your arm doesn't hurt and your elbow feels awesome and you feel strong and you're performing really well, you still need to do your mobility and your stretching and work on your strength exercises, even on a maintenance level. So it's not going to take you 2 hours a session, but doing a couple days a week of some strengthening and most days of the week doing some stretching and flexibility during the season can really help your body stay feeling well and help keep you on the field.
And Lael, any messages to other young athletes or parents watching that you want our viewers to know?
I was actually going to say the same as Dr. Key and Kyle, just doing your stretches every day and even having no throwing days, it helps a lot more than you'd realize.
Sure, that's a great message to get across when things are so intense on every level. Thank you so much for joining us. And Lael, we're so glad that you are back. Can't wait to see what you do in the future. And thank you to our viewers for joining the discussion today. Coming up Monday morning at 8 a.m.,
I have
Emily Shebb
goosebumps
learned
just thinking about it because I was in so much pain while in the hospital, then getting this diagnosis, and it was like, wait, what? I like pulled a muscle in my back.
She thought she did, but Emily Shebb learned her broken back was caused by a rare blood cancer. How a bone marrow transplant, a team of specialists, and her 10-year-old daughter gave Emily the strength to keep fighting.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.